Abusewa Esther, 200 level healthcare management student and nursing student from Unique Center. I'm a student of JPTS, Joint Professional Training and Support International, affiliated to South American University, Palm College, etc. I'm here to present my 10 paper, which has to do with the presence of hepatitis B in an antigen or in an antibodies that are surface the antigen of a patient. I will start with this. A secular immune response is associated with acute chronic hepatitis B infection, and this has been thoroughly studied. B cell response in chronic hepatitis B and the role of antibodies raised against hepatitis B virus envelope antigen in controlling and prevention of infection required further investigation. Antibodies detection helps in the cure of the virus and the infection, and inducing of vaccine neutralizes anti-hepatitis B that has been shown to protect those infected with the virus. The introduction. What is hepatitis B? It's a disease that affects the liver and it's caused by hepatitis B virus. The cause of the virus differs from person to person. At the first stage of 6 months, the symptoms are not visible, and this is a stage known as an acute stage. And at this stage, the person is able to deal with the virus. 90% of the person infected are able to deal with the virus. A major concern about this is that when babies are infected or during infancy or childbirth, 10% clear the infection and 90% reversed, or rather they remain developed into chronic hepatitis B infection, and this makes the liver inflamed, leading to liver cancer. How people get the virus? People get the virus via blood-to-blood contact and through premarital sex with someone infected with hepatitis B virus. Those at risk are injecting drug users, men that have sex with men, people with sex of that have sex with hepatitis B patients, and children of parents born with the virus in places that the virus is well pronounced. Those are the persons affected and lots more. The prevention of hepatitis B is done via testing and vaccination. You have to give the person vaccine, and the vaccine is 100% effective. Hepatitis B and its antibodies, which is the main purpose for this topic. When you are exposed to hepatitis B, your body mounts an immune reaction against its invader, and this occurs when you are exposed due to the blood or sexual contact if you are vaccinated with the hepatitis B vaccine. Let's also take note of this. Hepatitis B virus has protein on its surface antigen, and it causes the immune system to produce antibodies. And with the vaccine, the sample contains the protein only and the virus itself. The first response to your body will be exposed to the hepatitis virus is to manufacture hepatitis B IgM antibodies, and these early antibodies are produced to fight against the several parts of the virus, including its core, and those antibodies are seen in the initial response that eventually fades away. Your immune system begins to develop IgG antibodies, and it continues to produce these antibodies for the rest of one's life, and this immune attack hepatitis B virus, and it is exposed to it. Let's talk about the dramatical view. In my research, I have a diagram that illustrates the look or how the virus appears. So, and the virus contains 3 types of protein. The proteins are listed below: small hepatitis surface protein, middle hepatitis surface protein, and large hepatitis surface protein, totally composed of hepatitis B surface protein. Hepatitis B virus antigens. The research carried out, the presence of this surface antigen was done in a lab and indicates the presence of the hepatitis B infection. It was a lab that research was carried out, and it was found that this virus exists. Hepatitis B virus antibodies. In the acute infection, the immune system is also able to combat the foreign surface antigens by creating enough surface antigen within a few weeks of when the symptoms first appear. Let's know that 350 million persons are infected with this virus, and there's a chart to show forth some of the hepatitis B stages that one may experience. Thank you very much. Do have a wonderful day.